Hello and welcome to oh my God, started off wrong, but we're gonna do it again. Hello and welcome to this exciting discussion as we discuss doing more with less. We're gonna be talking about financing Africa's health system, and we have two amazing panelists joining us. But first, my name is Fatou. I am an MPH candidate here at the Harvard Chan School of Public Health. And with me, these are two phenomenal women. First, we have Rosine Sori-Coulibaly, who is currently the president of the Sahel West Africa Club, a platform hosted by the Organization for Economic Cooperation and Development, the OECD, to promote regional policies and provide solutions to food security and long-term economic growth. From 2016 to 2019, Rosine served as the Minister of Economy, Finance, Development for Burkina Faso, and briefly as the Minister of Foreign Affairs. And with me, we have Dr. Lia Tadesse. Dr. Lia Tadesse is the Executive Director of the Harvard Ministerial Leadership Program. Lia is the former Minister and State Minister of Health in Ethiopia, as well as holding other leadership roles. She assumed her role as minister the day after the World Health Organization announced the COVID-19 pandemic, and she played a crucial role in navigating the country through these unprecedented and challenges posted by the pandemic. So to set the tone, we are all going to be having a conversation to discuss the challenges, adaptations, and opportunities that we see moving forward in Africa, where we discuss doing more with less. So, to begin, I'm going to open up the floor to Rosine, and I would really love for you to sort of set the stage and walk us through sort of the challenges that we're seeing with global aid and funding in the African landscape today.
Thank you very much, Fatou, and good afternoon to participants. I would like really first to thank the T.H. Chan School for Public Health for inviting me. This is a very, very timely meeting because we all see that the world is changing. Concerning the theme, to get back to your question, ODA is decreasing, that's very clear. It's decreasing, and according to OECD, the level of ODA dropped up to 9% in 2024, and another decrease is expecting this year of 17%, 17%, which means that in 2027, we will fall down to the level of 2020. That's the reality, and there is no outlook telling us that the situation will improve. So it is really timely now to discuss about this situation because it's worldwide, it's impacting the life of the population, it's impacting Africa due to all the debt situation, the tiny fiscal space that is on the continent. That is really a very, very important meeting. I'm really happy to be here today.
Thank you so much. And to clarify a bit, you mentioned ODA. Can you explain that to some of the people who might not know what that stands for?
ODA, O for official, D for development, A for assistance, official development assistance. It means that ODA, in the ODA, if you have 20% of grants in the resources you are receiving, it's ODA. Sometimes it will be grant without any reimbursement, like the case of the UN, etc., some organizations. Sometimes you do reimburse, but it's sustainable. It's not, and it will not endanger your country. So that's ODA. So you didn't tell me that I have to define also the concept here.
Thank you so much. But I mean, you've sort of set the stage because you've kind of explained in context why we're seeing this loss of funds. So Dr. Lia, I'm going to switch it to you first and then come to you, Rosine. Can you please explain the impact and overall result that came with international aid and funding being reduced and even in some cases being entirely eliminated?
Thank you, Fatou. I think it's also important to first underscore the impact that development assistance had in improving public health across the globe, and particularly for the African continent. Particularly in the past few decades, we know its impact in saving millions of lives, particularly in reducing child mortality, maternal mortality, and improving life expectancy, the huge impact on infectious diseases, and also not just impact on recipient countries, but also globally in really enhancing global health security. And in the context we are now, where, as Rosine mentioned, with the significant reductions in official development assistance, particularly the impact is much higher in the health sector. And this is because there are so many critical services that have been disrupted with this cut. And the cut is both in terms of bilateral aid, which is directly to countries, but also through multilateral institutions that support countries like the WHO, which has significantly impacted not just health services, but also humanitarian assistance, which has a big impact in the health of a country. And as we know, many countries now are facing different crises with conflict, climate crisis, which has a lot of vulnerable and displaced communities for whom those critical life-saving, particularly commodities, have been disrupted, nutrition and health commodities. But also there are specific services like HIV, tuberculosis, malaria, and other maternal and child health services that have been affected with this impact, which, of course, there are a lot of projections which show that the number of lives lost could be really huge in millions, which we hope that it will be mitigated with some interventions, but it's going to be definitely huge, which are already being lost. But also the impact on not being able to deliver those services, because a lot of healthcare workers have also been out of work, because in many of those the countries, of course, there are different models in different countries. Some countries, for example, community health workers are fully funded by government, like the case of Ethiopia, but there are countries which also rely on funding, like the US funding or other countries, for actually running the community health workers which have been disrupted through these services. So all those service disruptions, commodities, are impacting lives.
Thank you so much. Rosine, would you like to answer as well? If we're discussing sort of the impact and result of global aid and funding being cut and eliminated, what would you say the direct impact you've seen?
No, I think that's the obvious. What Dr. Lia said previously, that's beyond the numbers, the billions that are that are in the ODA. We have to see the population. People will die for sure. Those who are not receiving treatments, etc. So globally, it will be a disaster, and not only for social sector, but because a country like mine, 60% of ODA goes to social sectors. So it will be a loss, a huge loss, not only for health sector, but humanitarian, as she said, education. So it is something. So the long-term impact is really huge. If you don't send children to school, it means that the development of your country will be at risk. So I think that we will take time to assess, because currently people have not really done an assessment of the impact. But I think that the price will be really huge on the continent and worldwide.
Agreed. You've touched on that we're experiencing in small ways that are affecting people now, but once we do complete a full analysis, you realize that the impact is much far-reaching. I kind of want to take a step back and let's reflect on sort of lessons from the past. You know, ODA, see, we're all learning. These funds essentially have worked well, but in some capacities they also haven't done much. So looking back at the past 20 and 30 years of donor aid in African health systems and African financing systems, sort of what would you say you've seen?
I think that it's a collective failure. Why I'm saying, I can just give you 3 examples. Remember that already in Africa, the international community, where they were discussing about the priorities, etc., etc. In 1996 already, there was this HIPIC initiative initiated by the IMF and the World Bank, saying that, okay, it would be like a debt forgiveness for those countries that are really poor and with a huge amount of debt. That initiative was, because you talked about 30 years back, so that's why I'm going to 1996. And you see that nowadays we are again talking about debt distress on our countries. So what have been done with the billions that were mobilized that time? Number one, going to 2005 with the Paris Declaration, big meeting, hundreds of countries attending a meeting with partners, etc., international and bilateral partners, saying that, okay, now enough is enough. We should put the countries on the driving seat, ownership of their own development. We should align on the country's priorities. We should be sure that there is a mutual accountability system in place. What has been done? What have been done nowadays, and then it's like a setback. Go now, very recently, after the MDG, the SDGs, big meeting, international community, saying that, okay, so by 2030, that's where we want to be. SDG 3 on health sector. And now you are withdrawing your support to those sectors. So I don't see the rationale on this international cooperation where decisions were taken and the result is that 20 and 30 years later, we are going back to the same situation. It's mutual responsibility, donor countries, and also recipient countries. The debt forgiveness resources. Where did we invest the resources? And we are now back to that situation. So I don't know, but it's something that really resonates to me because I started working in development sector for 40 years, and sometimes we do not see progress, and which is really worrisome.
Thank you. Dr. Lia, would you like to add, talking about health?
Yes, Rosine has laid out it in detail. I mean, definitely there have been positives as well in the health sector, as we have tried to mention earlier, in terms of ensuring access to life-saving commodities and impacting the progress in health outcomes in many countries, which is and also improving capacity in terms of health systems. But we also have to really see that the challenges that were there. I mean, the discussion on how can we improve aid effectiveness, how can we really ensure country ownership, and aligning with country priorities has been there for many years. And there has been maybe some efforts in terms of that direction. I know we've been working on having one plan, one budget, in one report in some countries to avoid the fragmentation of different donors working in different silos, which is not creating synergy, but also creating more burden in the implementing countries, but also not implementing or investing in a way that it can build sustainably the capacity of countries, both in terms of public financial management, but also in terms of health systems. So those were the gaps that have been always in discussion, and even if there were few efforts, which I think should be also recognized, but we are very far behind where we could have gone with all the resources. So there were a lot of inefficiencies that were there, which needed to change. But of course, as we all know, the disruption that has happened, that's happening now, not just in the US, but also across the globe, with many countries reducing their official development assistance. The way it happens is costing lives, but it's also why I think many leaders are saying it's also a wake-up call.
Yeah, thank you both so much for sharing. So then, in reflecting and looking about paths moving forward, what models can African nations adopt to take a step back from donor dependence and sort of move forward towards national leadership?
Should I?
Yeah.
No, I think that model is a sophisticated word because people are talking of models for years. The problem is what is the diagnosis, really? Donor side. Number one, the reality is that the donors themselves have their own problems. The problems are many. Currently, you will see that their own citizens are putting pressure on them. You will see that they have their own debt problems, including here, Europe, etc. They have also debt problems. The amount and the ratio, the debt to GDP ratio. This is something that's real, that's true. We cannot hide that. The second problem that they are facing or they are creating is the way they decide that they will not support your country in Africa if you are not aligned to their political agenda. That's something that should be in the diagnostic as well. I think it's important. Vote and support me, and then they give you money. Yeah, it's like, yeah, that is just the way it works. That's the reality. And third, I think also it's important, it's also commercially driven. Commercially driven, they want to do business. See America with the America First initiative. That's his choice, business. We are talking about tariffs, etc., etc. That's the reality. Second, Europe. They have also created their own initiative, the Global Gateway, business-oriented. You have China with the Road and Belt Initiative, because they want to support the government's own private companies to make business. That is the reality. And I think that it's important to remind us that the situation won't change. So we have to clean our own house. When I talk about we, it's Africa. So don't expect others to give you the solution. Don't expect them to come to another model, because the normal model should be a world that is fair for everyone, a world of solidarity, a world where the countries should decide for their own destiny. But it's not the reality. That's not the situation. Maybe, Lia, you have the solution. But me, I just am raising the problems. You can find the solution by yourselves.
Dr. Lia, I'd love to hear your solutions as well.
Rosine, I obviously don't have the solution. But I definitely agree with Rosine that it's a crisis that should not be wasted, for countries to take this as an opportunity to shift things. But it's easier said than done when we are talking about, yes, we are seeing a lot of initiative by many countries to know the gap and try to find ways to fill the urgent or emergency issues or address those issues by shifting resources. But if the gap is huge, it's not easily done, and this requires time. So yes, it's time for very strong country leadership for domestic financing of health, and that requires not just the health aspect, but also the whole development. It's about really working on enhancing development so that we can actually fund our own, finance our own health systems and care for our citizens. And there are different innovations that can also be talked about in this case, not just the overall increasing tax revenue and others, but also some innovations like health tax that can be utilized both to address health issues, but also to address revenue issues. But at the same time, I think critical life-saving services need, again, global solidarity. And this can be done by, should be done by existing donors, but also there are new donors that are also stepping into the space to fill in those challenges. There are different, beyond countries and governments, there are also, of course, private philanthropies which are trying to step in. So I think there's more need for global solidarity because, yes, there's need for more country leadership, ownership, and driving the agenda, but this needs time and it's costing lives. So particularly for addressing the urgent issues, the emergency issues, there is a need for more global solidarity. Um, it's also a time where the private sector can also play a bigger role. The private sector, when we talk about health and private sector, it's a sensitive issue because health is a public good and is not really profit only driven. It needs social impact. So the role, but still there is a role that the private sector can play in many countries, which starts from the service delivery up to the issue of commodities, which is the biggest challenge when we are talking about development assistance, where countries are facing shortages, where the private sector can play a key role. And I think there's also one thing to finally underscore is the need for stronger regional cooperation. Regional cooperation, particularly for the African continent, to be strategic in enhancing our surveillance capacity, enhancing our local manufacturing capacity in many ways. That stronger coordination of countries with a stronger regional platforms is really critical. So those are, I think, some of the areas I would think are key for the way forward.
Yeah, thank you both so much for sharing. I really love that you've both sort of touched on solidarity, because together is how we sort of can solve these issues as a collective. And even talking about solidarity, we've talked about finance and we've talked about health, but I would really love to talk about ways that local actors, sort of local community members, can play an active part in driving development on the continent. Rosine, Lia, I would love to hear from both of you, your thoughts.
I want to build on what she said about the private sector, and also go now, share also some good news, because I don't want you to be desperate. No, there are good news on the continent. Nowadays, we have the Africa Fair Trade Initiative, which is an initiative taken at the African level, at the regional level, in order to have Africa, having trade among ourselves. So now we have 15%. In the past 2 years, it was like less than even 8%, which is good. So I think that, there are initiatives that have been taken in terms of regional integration, which is good. But the message that we also should pass to the international community, Africa, 60% of the population of this continent is aging less than 25. It's a huge market. It's a workforce. So I do believe that it's important. The fertile lands in Africa, the minerals in Africa. It's important to know to say that we should not just stay crying. We should know that our continent has also some assets. If there is a leadership and if we invest on what we have, I think that we can move the continent forward. Now, getting back to your question on community, but I will be short this time. For the community, I think that it's important to involve like for the private sector, we have also to involve the community, because all the investments, all the services that are rendered by the government is for the communities. And there are initiatives on the continent. You see some young people for the crowdfunding that they do. You see also for building, clinics, etc., schools in villages, system to provide potable water. People are really contributing. This is something that's important. They should also be involved to make sure that what the government is doing is really right. Accountability system. If we involve the citizens, I think that would be good. And Lia, since you are here, Ethiopia and the other countries also, they use those who are abroad with a diaspora bonds to have resources to build the countries. I think that there are good news. Last point that I will make, this is not a good news. This is not a good news. Countries have also to address the elephant in the room. What is that elephant? Illicit financial outflows. The illicit financial outflows that are leaving the continent are more than ODA. So if there is a tracking system to avoid corruption, all this money leaving, fleeing out of the country, out of the continent, we'll get our own resources. So I think that we have also to be clear about that, to say that we have some levers If we use them, maybe it can be better later on.
Thank you.
I will stop
Thank you.
there.
Dr. Lia?
I think that's a very good point in terms of engaging communities, and Africa has, I think, a very good experience in terms of strong focus on community ownership, community engagement in many ways, both for our health systems but also broader. And I think that one of the good examples is our community health programs across many countries, where it's not only depends on the community health workers, it depends also on the engagement of the communities in terms of the ownership. And if you have seen many countries, for example, some of the clinics or health posts where the community health workers work on, they are not just constructed by governments or donors, it's through mobilizing communities. And there are so many local solutions that can come by engaging communities in such scenarios. And that kind of ownership, when you look at health insurance schemes in different countries, it is the engagement of communities that make it work. Because it usually depends on communities really believing that this will serve their families and then enrolling in those schemes, and that requires strong community engagement. So I think when countries that are facing these big gaps and challenges, when we are trying to move to the next level, engaging communities would be really critical. And the pandemic has really shown us how much local communities and diaspora communities, like Rosine mentioned, can play a huge role in creating that solidarity and support in creating a stronger system. So I'm sure that would be a key approach.
Thank you both so much. So we're almost at the end. I have one more question to ask before we wrap up. You know, a big reason why I wanted to do this and moderate was because as a young professional, as a student here at Chan, I was so honored to be here, and I want to hear from both of you ladies sort of what gives you hope? What advice do you have for all of us in this room, all of us watching? You know, what can the next generation of health and finance leaders learn? And I want to know. I'm taking notes.
Do you want to start?
Okay.
I count on your wisdom.
Oh, we'll reserve the best for the last then. Despite all the challenges we have, I like to see the glass half full. And our world has passed through many challenges many times, and with resilience, we have seen it pass through. So particularly for young professionals in public health, I understand this is a challenging time, and many are frustrated. Would I be able to contribute? But this is also the most critical time where leaders and open-minded and people are needed to make change in public health. So there is a lot to contribute. The need is huge, but focusing on really bringing different actors together to drive change, because we are talking about similar things in different ways, but really there's a need to coordinate and channel that towards the change that we are envisioning. But it is an opportune time despite all the challenge. So we count on all you, the next generation.
Please.
I would just repeat what she has said. I do believe that the young generation, you are luckier than us. You are educated. During our times, it was really a struggle to be where we are now. You are connected. There is no boundary. You know what is happening in Asia, etc. So you are connected, and you are dynamic and young. I think you should give the hope to us to know that, you know, some people were saying that our future are behind us. We want the continent future to be really ahead of everything. So we really continue. We encourage you as well. All these people, young people, you are in this meeting room, is really take that opportunity to see how you can change, informing, getting information, analyzing the situation, and getting the right solutions that you can bring to your continent. And I want to quote, because I'm not a medical doctor, but there is a humanitarian writer, Raoul Folero, you know him, he was on leprosity, he was working on that. He said something that's really important, that no one has the right to be happy alone. No one has the right to be happy alone. So if you believe on the continent, on the world, that you have a contribution to bring, that you are fortunate, but you should not be happy alone. Try to see how you can build and team up with others to move our world forward.
That was fantastic. Thank you both so much. And I want to thank everyone here today, for people watching in person, people watching online. If you would like to watch this program, please be sure to check out the Harvard Chan YouTube channel. So thank you so much for joining us today, and thank you so much for our guest speakers. Can we have a round of applause? Thank you.